The procedure is approved by the FDA for patients from 21 on up.
Although there's a significant number of surgeons like myself who will do surgery in an 18, 19, 20-year-old depending upon whether or not the patient has had a stable refraction. That is, the glasses prescription, the contact lens prescription. Has it been stable for 3 years prior to being 18?
Age restrictions really only apply to health conditions that might keep you from being a good candidate.
We need to measure the thickness of your cornea to find out if we've got enough cornea to work with, because we're only going to remove tissue when it comes to reshaping your cornea. So you have to have enough left over so we don't have problems post-operatively. We also need to measure the curvature of your cornea. We need to measure the curvature of the inside of your cornea as well as the outside of your cornea, because we need to make sure that there's no thin spots in your cornea, because once again, we're going to be thinning the cornea and we don't make a thin spot even thinner.
The range for LASIK is pretty broad. They must be within the range of refractive need. We like to have their prescription be stable for at least 2 years prior to their laser surgery. You really want to capture when they're stable so you don't have to do additional treatment later on.
Surgery takes about 15 to 20 minutes. You're in the building itself for about an hour to 2 hours, but the surgery is very quick.
LASIK surgery most certainly is permanent. Doesn't mean that you may not need an enhancement down the road to fine-tune the result from the primary operation, but it is a permanent change in the curvature of your cornea.
Laser vision correction does not correct age-related change to the eye. Among those is what's called presbyopia. So when we get into our 5th decade of life in our 40s, we'll all notice that it becomes more difficult to see things near us. And when that happens, we'll have to use some reading glasses to help magnify.
You're seen a few times following the treatment. One is directly the day after, then about 1 month and 3 months we'll see you back.
There's very, very minimal discomfort associated with LASIK. We give people a little sedation beforehand in terms of some oral medication. We do put some anesthetic drops on the eye, and most people get through the LASIK without feeling anything.
If you're up and about walking around after the LASIK treatment, it's likely that within that first hour your eyes may feel irritated, so we recommend lying down with your eyes closed and trying to take a nap. We recommend not driving immediately after the treatment, but rather to go home and rest. The next morning we'll have a recheck, and once you're cleared for that, typically you're cleared to drive.
For patients that are nearsighted, they'll generally see very, very well the next day. For patients that are farsighted, initially they'll be overcorrected and be fuzzy for distance but very sharp for near. As they heal after a farsighted laser treatment, they generally see pretty well for distance at about 1 month.
Patients can return to work after surgery usually the next day. Most of our cases are done on a Friday, and very rarely can a patient not return to work on the following Monday.
Laser vision correction is extremely affordable. There's many options. You can use Care Credit and finance at 12 months at 0%. You can also put money in your flex spending account and talk to your human resource manager. There are many ways to look at LASIK. If you go back and look at how much you've spent on glasses and contacts, over the next couple of years, LASIK will pay for itself. LASIK is not technically covered by insurance. We have contracts with many insurance companies that we're able to give you a discounted rate, so it will save you some money.